Contagious, in my definition, is when the content is good enough that people want to share it, that they want to go back and return for more.
And also we find it helpful for patients in aftercare, or when they've gotten a diagnosis, for them to be able to go home and share with their family and friends what, more about what that condition is.
The patients demand more time than the physicians can supply. And so we automate that process by allowing the physicians to speak on video and educate the patients on the patient's time while the physician's continuing to see more patients.
But certainly we can see that it's making a real difference for patients who report to us the role that having a video like that played for them in coming to see us. I mean, we definitely see the payback on that, in both financial and non-financial, more important.
Currently, when you have a procedure done, I send you a letter in the mail. I say, we took out 5 polyps and you have diverticulosis, and here it is all in writing. But I would love to hear more about, you send links to videos where the physician waxes poetic about polyps or diverticulosis or a high fiber diet, and you say, click here, click here, click here. We
built a physician reply service. When he meets with a patient, he has a clipboard, and that clipboard Matt has all the videos that he has available at his disposal. And a form letter gets populated when they click send, and it sends off a customized education tool that comes directly from your physician to, if you're the patient, to yourself. And it's an addition or an enhancement to the education process that happens during that 7-minute magical window when you're diagnosed. Physicians have 7 minutes to explain something. Patients are just dealing with the trauma of being diagnosed with something, how they're going to tell their family, so they're not retaining a lot. So how we continue that education process when the patient gets home, and the care that the physician puts into that process is essential. So now in the second meeting, instead of the physician spending the time re-educating or cleaning up misunderstandings, in that second meeting, we're now talking about strategy. And that creates a completely different environment.
Our videos can be a little longer. I mean, the 2 to 3 minute videos are great. And again, it depends on what the topic is, but if you're thirsty for a particular kind of information, you wouldn't have been too bothered if you had a 9 or 10 minute video versus a 5-minute video, because you're looking for that reassurance.
And I think sometimes people are craving for more, rather than, always trying to customize the content to these small little snippets. I think sometimes we might be leaving out too much, and
it's really nice to be able to get good comprehensive information where I can sit at home and watch it. If you're trying to get one of those viral videos that's entertaining and you want to share it all over Facebook, that's one thing. But if you're trying to get good information that you can really understand and explain to your family members in the case of something more serious, and you're trying to pass along that information and you don't understand it all yourself, you really do need more information than just a little snippet.
I think that it's getting cheaper and cheaper to do this. I think we need to embrace the technology. This technology is so great because you can just sit here, and if your quality is halfway decent on your camera, just go ahead and record it. Stick it on YouTube, then you have it.
Hangouts on air, this is an amazing thing from my perspective. It's really cool to be able to have multiple contributors organized at one time and then creating a YouTube video.
But then, Lee, there's also the question of how does that content, which is easier than ever before to make, get to the audience? How does it not get lost in just a sea of everybody's doing it?
That you don't necessarily have to have broad marketing kind of reasons for using these tools. It's more about being able to have more time with your patients, reclaiming the time, saying some things once on camera. And it isn't that you don't ever have to repeat it in the office, but maybe you can, you can at least reinforce it.
there's going to be opportunity for us to aggregate content, so you don't have to make the same YouTube video that your colleagues are making all around the country, but we can use this one YouTube that we all agree is good and spread that virally. And I think that ultimately will be some really valuable, contagious content.
I'm just going to thank all of you in one big virtual hug for being a part of this, and have a wonderful rest of the weekend.